Have you ever paused to consider the silent, invisible threat that STDs pose to our health? It's an often overlooked topic, yet it holds profound significance in our lives. An understanding of STDs and their impact is vital, but fear not, we're not here to scare you. Instead, we're about to embark on a journey of knowledge and awareness, exploring the common types, symptoms, and most importantly, the preventative measures. Join us as we delve into the world of STDs, their symptoms, and preventative measures. STDs, or sexually transmitted diseases, are infections that spread primarily through sexual contact. Now, you might be thinking, that doesn't concern me, I'm careful. But here's the thing, STDs are more prevalent than you might think. Every year, millions of people worldwide contract these infections. And the impact on health, it ranges from mild discomfort to severe complications, including infertility and even life-threatening conditions. But there's good news, knowledge is power. Understanding the nature of these diseases, how they spread, and their effects on our bodies is our strongest weapon in the fight against STDs. Education can help us make informed decisions about our sexual health, leading to safer practices and reduced transmission rates. So let's dive deeper. Let's understand these infections better. Because after all, wouldn't you agree that the best way to fight an enemy is to know it well? Understanding STDs is the first step in prevention. There are several types of STDs, but today we'll focus on the most common ones. First up is chlamydia, a bacterial infection that often shows no symptoms. However, when they do appear, they can include pain during urination and abnormal discharge. It's treatable with antibiotics, but if left untreated, it can lead to serious health issues such as infertility. Next is gonorrhea, another bacterial infection. Symptoms are similar to chlamydia, but may also include pain in the lower abdomen and conjunctivitis. Again, antibiotics can cure this infection, but it's crucial to catch it early to avoid complications. Syphilis, yet another bacterial STD, progresses in stages. The initial stage is characterized by sores which can go unnoticed. The second stage may present a rash, fever, and swollen lymph nodes. If untreated, the third stage can cause serious damage to the heart, brain, and other organs, even years after the initial infection. Then we have herpes, a viral infection that manifests as painful blisters in the genital area. There's no cure for herpes, but antiviral medication can help manage outbreaks and reduce the risk of transmission. HPV, or human papillomavirus, is another common STD. It often has no symptoms, but can lead to genital warts and even certain types of cancer. There's a vaccine available for HPV, which is the game changer in its prevention. Finally, there's HIV/AIDS. HIV is a virus that attacks the immune system. If untreated, it can lead to AIDS, a severe immune system failure. HIV may not show symptoms for many years, but once it progresses, it can cause a multitude of health issues. Antiretroviral therapy can help manage HIV and prevent it from progressing to AIDS. These are just a handful of the STDs out there, but they are among the most common and impactful. Remember, knowledge is power. Understanding these diseases can help you protect yourself and others. Stay safe and stay informed. STDs can sometimes be silent, but more often than not, they come with symptoms. Understanding these symptoms can be a critical first step in identifying and treating these infections. Let's start with chlamydia. This common STD often shows no symptoms, making it easy to overlook. But when symptoms do occur, they may include unusual discharge from the vagina or penis or pain during urination. Next is gonorrhea. Like chlamydia, it can also be symptomless. However, when symptoms do appear, they can include a thick green or yellow discharge from sexual organs, pain when urinating, or for women, bleeding between periods. Then we have syphilis. In its early stages, syphilis can cause sores, typically on the genitals, rectum, or mouth. As it progresses, it may cause a rash, fever, swollen lymph nodes, and fatigue. Herpes, another common STD, is characterized by outbreaks of painful blisters or sores, usually around the mouth or genitals. Between outbreaks, the virus can be dormant, making it easy to overlook. HIV, the virus that causes AIDS, can cause flu-like symptoms within 2 to 4 weeks of infection. These can include fever, chills, rash, night sweats, muscle aches, sore throat, fatigue, swollen lymph nodes, or mouth ulcers. Lastly, there's human papillomavirus, or HPV, the most common STD. It can cause genital warts, but often it presents no symptoms at all. That's why regular screenings are so vital. Remember, these are just some of the symptoms associated with these STDs. Many are easily mistaken for less serious conditions, like a yeast infection or urinary tract infection. That's why it's so important to get tested if you're sexually active, especially if you have multiple partners. Also, keep in mind that many STDs can be asymptomatic, meaning they show no symptoms. You could be infected and not even know it, unintentionally passing the infection to others. If you experience any of these symptoms, it's crucial to get tested immediately. Early detection and treatment can prevent long-term complications and help stop the spread of these infections. Worried you might have an STD? Don't panic. There are steps you can take. Firstly, it's important to remember that many STDs can be asymptomatic, which means they don't always show symptoms. This is why regular STD testing is so crucial. It's the only surefire way to know your status. Many clinics offer confidential and sometimes even free testing, so don't hesitate to look for those in your area. If you're experiencing symptoms or if you've had unprotected sex, seeking medical advice should be your next step. Health professionals are there to help, not judge. They'll be able to provide a proper diagnosis and, if necessary, the right treatment. Communication is also key, especially when it comes to your sexual partners. If you suspect you have an STD, it's important to let them know so they can also get tested and treated if necessary. It might be a tough conversation to have, but it's an essential one. Don't let fear or embarrassment hold you back. Each step you take is a step towards better health and peace of mind. And remember, many STDs are treatable, and all are manageable with the right care and treatment. Remember, it's better to know and seek treatment than to live in fear. Prevention is always better than cure, especially when it comes to STDs. The good news is there are several practical strategies you can employ to significantly reduce your risk of contracting these diseases. Firstly, let's talk about safe sex practices. This is not just about using protection during intercourse. Safe sex also involves maintaining open and honest communication with your partner about your sexual health histories. It means getting tested regularly for STDs and sharing your results with each other. This openness builds trust and helps ensure that both of you are aware of any potential risks. Next, regular testing is paramount. Even if you're practicing safe sex, regular STD testing is crucial in maintaining your sexual health. Why, you ask? Because many STDs can be asymptomatic, meaning they don't show any visible signs or symptoms. Regular testing will help catch these silent invaders early, allowing for prompt treatment and preventing further spread. Now, let's talk about vaccinations. There are vaccines available for certain types of STDs, like hepatitis B and HPV. These vaccines are powerful tools in preventing these diseases. If you haven't been vaccinated yet, it's worth discussing with your healthcare provider to see if these vaccines are right for you. Lastly, it's important to remember that abstaining from sexual activity is the only surefire way to prevent STDs. However, if you choose to be sexually active, these strategies can significantly reduce your risk. In the end, prevention is about empowering yourself with knowledge and making informed decisions about your sexual health. It's about taking control and being proactive in safeguarding your well-being. Remember, your sexual health is an integral part of your overall health. Don't neglect it. Take the necessary steps to protect it. By practicing these prevention strategies, you can significantly reduce your risk of contracting an STD. We've discussed a lot today, but remember, this information is not a substitute for professional medical advice. We've delved into the common types of sexually transmitted diseases, highlighting how they can be contracted and the typical symptoms that might indicate their presence. We've also explored the necessary steps to take if you're worried about having an STD, and most importantly, preventive measures to help keep you safe. But let's not forget, these are complex issues that require personalized medical advice. Every individual is unique, and so is every health situation. The content provided in this video is intended to be general in nature, serving as an educational tool to raise awareness. It's crucial to seek professional medical advice for diagnosis and treatment options. Never hesitate to consult with healthcare professionals if you have any concerns about your health. Stay safe, stay educated, and remember, your health is in your hands.